Hello, I hope you were able to enjoy some of that fall weather this weekend. It certainly came about quickly, and I know that we're going to see some more sun this week, but it certainly is fall, and we'll all have to dress appropriately and be ready for it. I'm so excited to tell you that New Jersey has passed a very important milestone. 75% of all New Jerseyans are fully vaccinated, and obviously that helps with the continued reduction of the transmission rate. We've been below 1 for just about a month, and that's very, very good news. I'm also want to reminder the flu vaccine. We are hearing lots of caution about the flu being very bad this year. So please make sure that you get your flu vaccine as soon as possible. Being able to vaccinate early, of course, is the best prevention we have against the flu. We do have a lot to celebrate this week in reference to different groups that we are honoring. First, I want to do a quick shout out to our healthcare security workers and security officers. Those folks are so very important, especially during this time when we're seeing people just being a little bit more on edge. We're seeing mental health and behavioral issues showing up more in our hospitals, and obviously that's a tremendous support to our staff as we're trying to maintain the calm that we need to maintain for healing, as well as just the number of people who continue to require care. October 19th also marks World Pediatric Bone and Joint Day. Now, obviously, it's critically important to make sure, especially as we come out of COVID, having your children back in sports and making sure they're physically active is something that's critically important, we know, to children's health, but you also need to be careful. We find ourselves making sure that we don't, even in our kids, ignore those falls and bruises, because they can turn into something much worse if not attended to quickly. And obviously, Inspira always stands ready with you to navigate your orthopedic and any other journey that you have. We actually have navigators available to make sure that we can get you to the right place in the fastest period of time. This week also marks our pharmacy department week, and believe me, in COVID and all of the things that we've been working with, having that pharmacy partner has been so critical in the administration of the vaccine and understanding how to work with the infusions that we do to treat the COVID virus, and then, of course, just all the things that we normally do to make sure that we have our drugs available and ready. Our in-hospital program, where we're actually filling the meds before people leave, has been such a tremendous success. And so none of this could be done without the leadership and the support of the pharmacy department. In addition, it is Healthcare Quality Week. Healthcare quality has become a critically important part of all that we do. It's in our strategic plan to talk about our commitment to making sure that we are delivering the highest quality service every single day. And so we have committed ourselves by becoming a high reliability organization to really ensuring that we're protecting every person every day with all of the tools that we possibly can. So I thank our healthcare quality leaders and all of the healthcare workers who are working so hard to prevent harm every day. Lastly, I want to recognize our emergency nurses, emergency room nurses, and our emergency nurses that work on the rigs. We find that front door for many of us, which has become our emergency rooms over time, is just so critically important to manage. And I just want to do a special shout out to each of you. I know these times have been hard. I know people's tensions are high, and you feel that more so than probably anybody as we try to maintain calm and get to healing as quickly as possible. But we are so grateful for all that you do, and so thankful for the teams in the emergency rooms to be able to help navigate all of this. So speaking of nurses, I want to share with you about a neonatal nurse who went through her cancer journey with Inspira. Sarah Keaton, who now works with us in our New Jersey Cancer Early Detection Program, has a wonderful story to tell you about her own journey.
I was diagnosed on February 1st, 2017, which was actually my oldest son's birthday. I was 32 years old, so I wasn't in the age range of getting screened and had no family history. But being symptomatic with a breast lump, it was very important to get that taken care of and get that diagnosed. I had all of my treatment done at Inspira Health, and I'm so grateful for the care that they gave me. Had I waited or had I ignored the symptoms that I had, my story could have been totally different.
So as we enter the end of Breast Cancer Awareness Month, I think we all need to heed Sarah's story, making sure we're listening to those signs and really taking time to be able to get those necessary services. And of course, Inspira stands ready to provide them and welcomes you to come and ask us to walk whatever journey you're on with you, because we know together we do this better. Until we meet again, be well and stay safe.